Zoom. Okay, hi there, everybody. This is Tony, the Hearing Loss Association of America, Mission Viejo chapter, and today is May the 11th. We have two very special presenters from Amazing Hearing, and it's going to be talking about cognitive issues, and in particular about Thrive, which is a new diagnostic tool. And I'm going to stop there because Anne Mundell-Noel and Laura Hunt from Amazing Hearing is going to tell you all about it. So, Anne, unmute yourself.
Good morning. How are you? How's everybody doing? Everybody wave to everybody. Yep, we're all here. Okay. We want to thank you, Tony, and the Hearing Loss Association of Mission Viejo for having us today. We want to make this a very interactive type of talk. So we will give the beginning portion of the talk some information about cognitive functioning and what that means. And then the second half of this talk, we will be talking about any topic that you want to discuss related to hearing. And we will have a whole list of subjects up there because May is Better Hearing and Speech Month. So Tony, if you don't mind, can we share the screen?
You certainly may.
If you have questions, wait till the end. As far as let us get through the initial presentation of this cognitive test, and then we'll take questions at the end of that. You gotta go to a minute. Are we on? We're good?
Oh, okay. You know, did you turn on captions on your PowerPoint? We're going to have them twice. Something's not right here.
Okay, so let's see what we should do. Subtitle settings, and can we undo this?
Yes, there. Whoop.
Is that what we want? Are we good with that?
You could turn them off, but I think you might have to restart the presentation.
Okay.
Yes. Yeah, you need to, let's stop sharing for the moment. And when you're offline, go in and uncheck in your PowerPoint where you were able to edit it, uncheck subtitle.
How do you turn it off? I think
you have to go in. You've got to get out of the show part and go into the editing part.
Yeah. Yes.
And on the towards the right side it says always use subtitles. You want to uncheck that.
Well, okay. So while Laura's working on that, I can go ahead and talk a little bit about cognition. What happens with hearing and hearing loss? I assume she's got the screen up, but I assume you can all see me. Is that accurate?
Yeah, we see you perfectly. Yes, you and Laura.
Okay. So what I want you to understand with today's meeting is that when we have hearing loss, you know that there's an extra burden that comes with that. And when I say burden, you know that there's more effort or energy that needs to be spent in order to communicate with someone. So what they have done recently is they have done longitudinal studies to see, well, what effect does that have with hearing loss? We know that people have more trouble hearing, but what does that really mean? So they did a study, and it is in the Lancet Research, which is one of the most respected medical journals available. And in the Lancet study, they showed that people who have hearing loss and don't do anything about it are further down the scale when it comes to cognition than those people who do something about it. And you kind of say, well, that makes sense, because if I have a hearing loss and I'm not doing anything to proactively improve the situation, then I'm not giving the brain a full spectrum of sound. So if I have a hearing loss, instead of giving my brain 100% of the information that it needs, I slowly give it less and less information when I have more and more hearing loss. So if I have a mild hearing loss, I might be giving my brain 80, 90% of the message, but I'm not giving it 100% of the message. And I know that we all understand that. And then the more hearing loss you have, the less information that the brain is receiving. So we all understand that, yet people don't understand or relate that information into normal everyday processing. So what I mean by that is people say, well, I have a little bit of hearing loss, but I don't think it's bad enough. Or, you know what, I have some hearing loss, but I'm not going to do anything about it. Well, what you're saying in that regard is that, well, I have an issue, but I'm okay not being at a quote normal level. The problem with that is that you might be using some other skills to get by, right? We might be using visual skills to do lip reading. We're using sentence structure to figure out topic. We are using intonation. We're using inflection. We're using a whole variety of skills in order to get the information that we're not giving our brain naturally. We're not giving our brain that 100% message. So what happens with that is that goes further into the brain is not getting the stimulation that it needs. So not only are you having to work a little bit harder to get the information in, but the brain itself is not getting 100% stimulation. And you say, well, what does that matter? Well, what we have shown through the research is that when a certain part of the brain is not being stimulated, it atrophies. It starts to decay or not be utilized as well. The area then becomes less productive. And other parts of your body or your brain start to take over. So you think, well, what does that really mean to me? When we don't have a full spectrum of sound, we start exerting other parts of our body to try to help us out. And like I said, we do the lip reading, we using our eyes, we lean forward, we start using our neck, we start to do all these other things to compensate. So what we want to do today is to talk about how this decreased activity in the brain, the hearing loss, is affecting you in other parts of your life. And so right now we have a screening tool. Tony, I wanted to correct you. It's not a diagnostic tool in any way. This is a screening tool. It is something that you might see in your neurologist's office or in your ophthalmologist's office. Audiologists are just starting to get on board with this testing to be part of our test battery. So it's nothing that is diagnostic. It's not an IQ test. It's really a very quick screening to kind of see how fast your brain is processing information and how quickly you can make adjustments. So with Laura, if you want to move us forward. So the name of the machine is called Thrive, and it is by a company called CogniView. So I don't know if any of you have seen this in your neurologist or ophthalmologist office, if you have done it yet. I'm going to be honest, this is something that we are experimenting with right now. We are one of the test sites to assess this piece of equipment to find out how accepting patients are to it and how well it helps us to help you make a better choice when it comes to hearing aids. So the bottom line is it's a tool in the toolbox. It's nothing that is going to be, you know, determining one thing or another. It's just a piece of the puzzle. So I want to get that through to you, that it is not an IQ test. It's nothing to be afraid of. It's kind of like when we have you come in and do a hearing test. I know a lot of people get nervous about pushing the button or repeating the words. It's just another little screener in that whole battery of testing that we're doing. So the reason that we're doing this testing is because there's a lot of things that come into play with cognition. And cognition is kind of the ability to know, right? The ability to recall, the ability to process. That's kind of the definition of cognition. But all this list, when we look at heart concerns, why is heart concerns a contributing factor to cognition? Because it's blood flow. The ear is the smallest organ in our body when it comes to blood flow. So if we have heart issues, we're going to have possibly hearing issues and possibly processing issues. Diabetes is another one. The high blood pressure I just talked about, as far as your medications can thin out your blood. Eye or hearing impairment can cause cognition effects. Medication, exercise, sleeping, poor diet. All those things are affecting how your brain processes information. And I don't think anything on this list is new to anybody. But it's just a reminder that what we think and how we think and process is so interrelated with everything that we do. And so what we're going to do today is Laura is now going to talk about this screening test that helps us with determining possibly what level of hearing aid technology can help you. Do you want to go ahead?
Yeah. So as Anne just mentioned, the test is truly a screening. So it's not an IQ test. It is just helpful, hopefully on our end and the patient's end, to have a better understanding of where they are with their processing. So the CogniView Thrive is specifically looking to give a baseline for your speed and accuracy in processing. It only takes 5 minutes to do. And again, it could help us in determining the best hearing aid or whatever option we're looking for to help someone improve their hearing and processing abilities. So as she mentioned, it is another tool in the toolbox for us. Here, I just wanted to show that it's essentially sitting in front of something like a laptop. And when you take the test, it does give you instructions for each part of the test. So there are essentially 5 things it is assessing. 3 of them are cognitive domains. So it's looking at memory, visual spatial ability, and executive function. And lastly, it's also measuring, as I just mentioned, the speed performance. So reaction time and speed processing. But the only thing you have to work with during the screener is a small handle that's at the bottom that you can see in the picture here that you maneuver with your hand in a circular motion. And they also explain that when you're starting the screener, how to use it. The first few exercises just are checking your motor skill and visual acuity. And so at first, you're watching for white dots on the screen, and they are going to move around and you are using a green wedge to stay on top of those white dots as best you can. So they're moving around and you are using that handle to make circular motions to stay on top of it. And then they change and you still follow those dots, but they start to become faded. So they're harder to see over time. So again, kind of stressing the body and the brain a little bit to really focus and stay on those dots. Thank you. It also uses shape perception. So it asks you to identify which shape looks different than the others. And they're not traditional shapes. They're kind of differently made shapes. But again, it's checking also the speed at which you can identify which one is different. So you're turning that circle again to identify which one is different. And then last, it looks into word memory and word perception. So now you are asked to find or identify the common three-letter word in English. And first, you're just finding which one is the common word among other made-up three-letter combinations as fast as you can. And then it will actually display and blink several different three-letter words in the center of the screen, and you are asked to identify the first word that appeared. So a little bit of memory, and then as fast as you can, finding that word that you are supposed to be identifying. Let's see. The next one. Yeah, thank you. And so again, part of the puzzle, directly we might think, how does this screener relate to my hearing? I'm in an audiology office. What is the direct correlation? Well, we know it's more about the overall effect on cognition and processing in the brain, which is in turn related with hearing. But when we're looking at those different tests, they are also related to audiology in that we're looking at processing and understanding complex sentences and being able to quickly recognize speech when we're in challenging conditions or noisy situations. It also is helping us understand how fast can we localize sound or utilize those visual cues effectively. And it's also helping us recognize our ability to focus on speech, a single speaker and noise, or multiple speakers at once, but then also focusing on speech while ignoring irrelevant distractions.
Right now, Laura, how do we get this off the screen so that they can see us without
the background?
Without the background. Is that?
I can stop my share.
Okay. So what we want to do right now is take any questions that you might have about the CogniView. And let's just start with that as far as information that we have so much information to give, but I'm not sure kind of where everybody is with their knowledge of this. So why don't we open it up to a couple questions right now, and then we'll move on to another segment. Has anybody got questions?
Yes. First question is Sharon. You want to unmute yourself?
Yes, hi. Thank you both for being here and presenting today. This seems like a very interesting tool. You mentioned that it could help with selecting hearing aids. So let's assume I am a hybrid. I have a cochlear implant on one side, a hearing aid on the other. I'm very happy with my hearing aid. It's fairly new and powerful. Would this help in other ways in terms of oral rehabilitation, or are there other things that it could be assistive to enhance my life and make it take down the cognitive load, but allow me to comprehend better than I do?
Good question. Yes, the assessment or the screener would give us a processing time. So you get a processing accuracy score, and then you get a processing speed score. And there are 5 different categories that they look at in the screener, and it could help to say, well, if you're not processing as fast, these are oral rehab activities that you might want to try. If your processing is slow, maybe you want to look at a different type of hearing aid that might be giving you more speech reduction, that might be a faster processor. On a different note, if people are processing quite fast and quick, then they don't necessarily need the hearing aid to do as much work for them, right? So that on our end, we would say, well, you don't have to go to the highest level of technology. You could use a hearing aid that has a little bit less processing speed because your brain is doing the work for you. So it could go both ways. I don't know that they've really delved in too deeply into what oral rehab you would need based upon those scores, but I know that those are things that they're definitely looking into. Good question. And I will say that Tony took the test. Tony came into the office and took the test. And again, I'm going to tell you, people are apprehensive in the beginning because they feel like, oh, and Tony was too, right? I don't know. I don't want you to see what I can and cannot do. She can tell you her experience with it. But again, it's just like doing any of the other little test batteries. It's not meant to single you out or make you feel less than. It's all about just having more information and being honest with your provider so that we can get a better idea of what cognitive load you really have.
Thank you, Sharon. Maureen, you want to unmute yourself and ask your question?
Yes, I have hearing aids, and I was very pleased with them at first, and they are Oticon. But I have found in the last 2.5 years since I first got them, I've had them adjusted a couple of times, but I'm just not hearing as I think I should be able to, as far as picking up differentiated words. Mm-hmm. You know, when you're tested and they give you one word, I can pick it up. But when I'm watching television and they're talking, you know, at a mile a minute, I'm missing out on a lot. Mm-hmm. And I do have my living room T-coiled. Okay. So I am using T-coil, and I'm still finding I have to use the closed captioning. And I don't think my hearing loss is that great, so I don't know what's going on.
So thank you for that question. So the question would be, I'm kind of assuming something, but go ahead and tell me what your question is.
I'm wondering if this test is something that could help differentiate whether I need what apparently, according to your ad on TV, is the new Oticon hearing aid, or if that's a whole different ballgame.
So good question. 3 things really. When you got your original hearing test, did they do something that's called a quick SIN, S-I-N, which is sentences and noise? So that's the first test that we have been doing for 10, 15 years that really starts to stress your system where you're hearing sentences and noise, not just a single word. So that is one of the first tests for cognitive load that we have been doing routinely. This second test that we're introducing right now, this CogniView, is to supplement the speech and noise test to give us more information, not only about the brain filtering, but how fast the brain is processing and then how accurately it's processing. So it would come into the scope of all of it. So the first thing I would say is I would look at your speech and noise score. And that right now is a big indicator to me as to what level of technology you should be in to have the results you're expecting. The second thing I would look at is your understanding scores. What are they in quiet? Are you getting 100%? Are you getting 56%? What are those scores? Because it's not always the hearing aid and giving the brain the sound. It's the hearing aid's job is to give the brain the cleanest, clearest signal to process. And then it's up to the brain to do the work. And so even though we might give the brain the greatest sound from the new Oticon hearing aid that's separating it from the background noise, but if the little hair cells in your ear are not presenting the brain with a crisp, clear signal, and it's getting distortion, then you have to have that realistic information to say, these are your expectations, right? I can't give you more than what your ear or your brain is capable of doing. But our job as audiologists is to figure out what that is, set the realistic expectations, and then fine-tune the devices to the best of our ability so that you can get your best ability. Does that make sense?
Yeah, it sure does. And I'm assuming I can call and make an appointment.
You can. The other thing that we do, and we're going to talk about this on the back end of the segment, is that there are things, and Tony is a huge advocate of this, and this is one of the great functions of the Hearing Loss Association group, is patient education and knowledge. Knowledge is king, as Tony says. You can hear better when you understand more, and I totally agree with that. Yeah. But one of the things is that you should get a real ear measurement. When you get a real ear measurement, it doesn't mean that you're just hooked up to the computer in your hearing aid dispenser or audiologist's office. It means that they're actually putting a little microphone in your ear in real time while you're wearing the hearing aid, and then you play speech, usually a passage about carrots. So if you haven't heard the carrot passage, you probably haven't had the test, but it measures in real time what's happening. And maybe it's just that your hearing aid needs to be reset more appropriately in a different way, the compression, or there's a lot of factors that we can adjust. So those are two things that might help.
Thank you.
Mm-hmm.
Thank you, Maureen. Okay, I don't see anybody else's hands up. The questioning is being open to any question you have regarding ear molds, types of hearing aids.
So before we do that, Tony, could you just talk a minute about you taking the test when you did the screener?
Oh, the Thrive test?
Uh-huh.
Oh, gee. When I first took it, I just felt so stupid. I just I said, wait a minute, because I really didn't understand what I was supposed to do and the process. And the more I got into it, the more I realized that I was supposed to follow these things around and be on top of them, or picking the word amongst the other three words or whatever. As I continued taking it, I got a lot more comfortable with it, and I understood what it was wanting me to do to catch up. I mean, to be on top of it. So, but in the beginning, it was, I said, Anne, can I start from the beginning?
Yeah, so they are doing now, it's kind of like when we do the sentences and noise. We give you a warm-up test. We give you 6 sentences to kind of practice, to kind of get your brain warmed up for background noise. And then we do the actual test. And so with this screener that they have right now, they have a very small warm up. And so they just modified that, Tony, and they now have a new kind of protocol that gives you a little bit more instruction and a little bit more time to practice based upon feedback like yours. So thank you for taking that.
Yeah.
The other thing that I want to talk about before we go into, and we'll put up the piece about the puzzle, and I don't know, can we put that to the side and have us both so they can look at our lips and look at the piece of the puzzle?
They can do that on their end, yes.
They can do that on their end. Is I want to talk about getting back into noise. So what I mean by that is we have had a very quiet world for the last year and a half. And the brain has gotten lazy. I'm just going to say that. For those of you who still wore your hearing aids every day, all day long, it's not the same as being in the noisy world and wearing them all day long. And we are having people coming back into the office saying, I'm really struggling in background noise. I'm not hearing as well as I used to. And we are actually turning some of the hearing aids back down so that they can kind of get warmed up again in order to get back into the real world. So as activity picks up, I want you guys to know that it's just like exercising. You might have been stretching, you might have been doing a little work, but now when you start running, a whole different thing happens. And it's the same thing with the brain and the hearing. We talk about cognitive load on this puzzle piece, if you have it there. Cognitive load means I only have a certain amount of time to process. So am I going to spend all my time getting the information into the system for me to process? Or does it come in very quickly? Now I have time to spend understanding and remembering and storing the information so that I have it for a later date. So how your hearing aid works does directly affect your cognitive load. And I hope that's the big thing, that's the takeaway today, is that the hearing aid is an aid. It's not a cure-all, but the way that it's set and the way that it functions does affect how your brain processes the sound, uses the sound, and stores the sound for everyday life. Does that make sense? Yeah?
Okay. So Daniel has a question. You want to unmute yourself and ask your question?
I thought I had.
Oh, yeah. You're unmuted, Daniel.
Oh, yeah, you're
I'm
unmuted.
unmuted. Can you hear me?
Yep.
Okay. I was wondering if this is the kind of a test that if you took it every year, you could measure the progress or the loss of an individual.
So, yep.
So, yeah, so I was going to say, yep, some audiology offices are starting to use it also as a way to measure over time. Are we seeing improvements in speed processing with consistent hearing aid use? But also going along with what you said, Daniel, we can also then watch on the back end, are we seeing a reduction in speed processing? Are there any red flags coming about? You know, the hearing aid is set well, they're doing well on all the other tests, but now we're seeing that that is getting worse or slower. And so in that case, if we do see that, we can refer out or make a recommendation to the appropriate professional, potentially a neurologist, to say, hey, we're seeing this change. Is there anything that they need to do and follow up in that regard?
Thank you.
Yeah, in the same regard as maybe going back to the slide with all the list of things, like, is it the diet that's affecting it? Is it your medication that's affecting it? Are you not exercising as much? Again, all these things don't seem like they are interrelated, but they are. So the more that we start to see a shift in that screening score, again, we're not going to call it a test, but in the screening score, the more that we would be able to make a referral or look at making an adjustment. And we already do this when we do our hearing and noise testing, our quick sentences and noise. So besides your hearing test, when we tax your hearing, by testing you in noise, if we see a shift in that score, we do make those same referrals and ask these same questions about, are any of these really changed or affected?
Thank you.
So the other thing I want to do is the puzzle piece. What I wanted you to see on that, go to that one, is that these are all the pieces that come into hearing. So May is Better Hearing and Speech Month. And as audiologists, yes, we do hearing tests that are diagnostic. We look at the cognitive load. We work with hearing aids and cochlear implants. The focus is really going to start to get more on therapy. We do some oral rehab, but we are going to have some new tools that are coming out to help you as the patient be able to do them at home. Maybe a computer group like Tony has right here where you'd get together and do some therapy together. There's a lot of interesting things that are coming down the pipe, so I'll be able to relate those to you. But we have assistive devices. We talk about your balance, tinnitus, ringing in your ears, wax, medical concerns. So there's a lot of things that go into hearing and understanding. And I wanted to put this piece up because I wanted you to see that when Tony's doing her HLAA meetings, she's trying to touch on all these different pieces a lot. And the more information that you have about them, the better equipped you are to live life.
Okay, George, you want to unmute yourself? Ask your question.
I see in your puzzle, you have one called balance. I know I have some balance issues. What is it that you do that might be helpful?
Well, the one thing that we want people to understand is that hearing and balance are related. They're in the same bony structure. The fluid from the inner ear, which is where we do our hearing or the electrical impulses are converted, is the same fluid that's in the semicircular canals or in our balance system. So it's what we want you to understand, and George, I know you have gone for therapy, is that the more hearing loss you have, the more chance you have of having balance issues. Now, our balance comes from our eyes, our ears, and the bottom of our feet. Okay, so think about that. Our eyes, our ears, and the bottom of our feet.
Right.
Whatever we can correct to the best of our ability is what we can do to help our balance. So if our vision is going down, then we're going to rely more heavily on our hearing to be as the best it can be and our feet to be the best that they can be. If we have neuropathy in our feet and we have visual issues, then we're going to rely more heavily on our ears to try to keep us in sync. And you know, I know George did some balance therapy. The whole idea is to have a strong core. The stronger our core and our muscles are to hold us upright, the better our balance overall is going to be. The other thing to talk about in balance is vertigo, right? Spinning, room spinning. And so as an audiologist, those are things that we also assess and work on. But balance in general is just for people to be aware. They don't realize that if they don't wear hearing aids, and again, going back to what I was originally saying, they don't wear hearing aids, they're not giving their brain the full input of sound. They don't have 100%, they have 60 or 70 because they chose not to wear hearing aids. And then they wonder why they're unsteady or off balance. You've got to give your brain as much information as it can to do its best job. Does that answer the question, George?
Yeah, that is.
Yes. I think I better have my vision checked, and I know my hearing is perfect.
Yeah, as good as it can be.
Thank you, Anne. Speaking of that, people should be aware of wax problems. And you can use me as an example if you wish, Anne.
Well, so when you feel like your ears are just stuffed or just not as good, your hearing might be a little bit poor, it doesn't hurt to come in and have us check your ears for wax. Laura will tell you we have a new machine. Do you want to tell them about the irrigator?
Sure. So we have a nice new tool that helps flush wax out of the ear just by using warm water. It's called the irrigator, but it's very nice. It's much easier on the patient's ear, more comfortable, than prior tools. So yeah, it's a nice feature.
George,
tool.
did you use the irrigator? I don't remember if we did the irrigator on you.
Yes, and it was so much fun, even if I don't have wax. I think I'd like you to do it again.
Yeah, a lot of people call it an ear jacuzzi because it feels really
Yes,
nice in your ear
yes.
because it gets that itchy skin out from down deep. I don't mean to offend anybody, but we're kind of.
I'd like to add about the balance problem. As you know, I went to Mark for a long time, but I stopped going because of the pandemic. Now that that's on the wane, I think it might be a good idea that I go back. I tried to do some of that via Zoom, but it's not the same.
No, and it's not. But again, just reminding people, I'm going to give you one little exercise that Mark Wegner, who is the doctor of physical therapy at Balance Rehab that George is referring to, he has been a speaker in the past for Tony's meetings. But one easy activity you can do is to stand at your countertop. And I'm going to try to stand up here to see if you can kind of see me. I'm going to stand up. Laura,
Yeah, I can
move the camera. And what I'm going to do is he wants you to put your hands near the countertop and lift one leg and go, oh, wait a minute, I'm going to fall. Lift one leg and just see if you can stand on one foot and then put it down. And I'm going to hit my chair. But then lift the other foot and stand. And just even you're putting your hands right in front of the countertop. So in case you fall, you have yourself to balance right there. But if you practice, you can get stronger in your core just by doing that activity for 30 seconds. Then do it for a minute. But you have to use the bottom of your feet to balance yourself. And you don't realize that you build strength and confidence, because when we walk, we really walk with 1 foot at a time. Our gait is 1 foot. And so that's why he has you practice lifting 1 foot at a time. And that's a little easy exercise that I picked up from him that has made a big difference even in my own life, that I've gotten my own balance much stronger because I practice that.
So that means every time we go to do the dishes, we should be doing some knee raises.
Well, you could, and even it doesn't have to be that high. It's even lifting it off the floor 10 inches. Just practicing lifting the foot, but shifting, because again, your eyes, your ears, and the bottom of your feet are your balance. So you say, well, how do my ears help with balance? When your brain is getting a clean, clear signal, it knows better where it is in space and time. And that is the key. It's kind of like if you walked around with glasses and you had Vaseline on them, you're not going to see as well. You're going to feel kind of foggy. The same thing is with hearing. By having your hearing aids in, you're giving your brain a cleaner signal. It has a better spatial relation of where it's at. Other questions?
Well, I'd like to add, and as the clock ticks on and the months go by and the years progress, if you don't take care of some of these issues, they're just going to get worse on their own.
Yeah, and that's a good point, George. But the other thing, and the thing is that more and more people are doing things about hearing loss earlier and earlier in life, right? They don't see hearing aids as a negative, but just something that's there to help. And because they connect with your phone and they connect with other things, they become a part of our life. Yet what I want people to understand is the technology is getting so much better for pulling the words from the background noise that it is easier on the cognitive load overall, because the hearing aids are doing such a much better job. And they are coming down in price. I know people go, no, they're not. They are. Hearing aids, you can get a great quality set of hearing aids starting at $1,000 a piece. And I know that seems high, but we don't sell things that are not going to be helpful. So all the hearing aids today connect to the iPhone. 99% of them connect to the iPhone. So you can now get a strong signal to noise improvement on the phone. But I know people address the hearing aid cost. That's something that's kind of the white elephant or the elephant in the room. The hearing aid technology matters. The quality of the sound matters, just because it'll make it easier on you to process the sound long term. So I just want to encourage you, do something, because like George said, it's going to get worse on its own, whether you do something or not. So get the most out of life. That's what we want to help you do.
Eloise, I saw you nodding your head in an affirmation. Would you like to make a comment about that?
Yeah, sure. Well, I can vouch for that, because I have my hearing aids for almost 6 years now, and my hearing aids cost $3,000 each. And I've gone through 4 or 5 different hearing aids, and I've been deaf, hard of hearing since birth, and I'm 68, going on 69 years. So they're much cheaper now, and they're so much better than mine. And I have ReSound hearing aids that are streaming, and these were the first hearing aids that ever did that. So I spent $6,000 on my hearing aids and $1,000 on my iPhone 6 years ago. So that was a lot of money then, and that was unheard of, but I wanted to be able to hear, because I had to work and I had to be able to communicate with people. And then I went recently and bought a device that everybody has to make sure that they have. This is an assistive listening device that I actually use when I go out to eat with people in the restaurant, or when I'm amongst others in a group. It's a mini mic that I turn on, and I can put it in the middle of a group, and I can hear everybody without the background noise. And I turn it on, and I can hear everybody talk. And it becomes my microphone, so that I can hear what everybody is saying in the circle of friends. And everybody kind of joked, but they thought I was taping them. But in actuality, I could converse with everybody without dropping a word. And it was monumental, because it was like I had perfect hearing like everybody else, and these were all older people. And I do a lot of educating, because I brought the loop to our church. We have a lot of loop buildings in our Sun City community, and I'm doing a lot more of education regarding the loop, because we have a lot of people that have hearing aids that have the T-coils in, and they all want to have the loop. So while I don't think we have a lot of assistive devices that they're using, I wear this so they can see it, so they can look for these devices to help them hear. So I think your part of the puzzle here is the fact that these things are also helpful when you have your hearing aid that only goes as far as your hand. But this device takes it farther. It goes up to like 12 feet. So, you have to look for these devices to go along with your hearing aid. And you can take it from there.
Yeah, and thank you for that. And for some people, those are necessary. Other people, they don't need them. But it's wonderful with the technology that's becoming available. And even with today's hearing aids, your iPhone can be that mini mic on many of the hearing aids that are connected to the iPhone. There's actually a little microphone setting on your phone that you could use. It doesn't have the strongest sound fidelity like a mini mic does, but it is something that you can use without purchasing something else. So it's great. The technology is getting so much better.
Yeah, I just wanted to say that I've observed just over the last 3 or 4 years a ramp up of technology. So anybody that is thinking about getting new hearing aids, and they got theirs 5 years ago, they may still be working, but you're not getting the benefit of this wonderful new technology and the assistive devices that come with them, optional. But some of the, like Au.D comes with that little clip.
Mhm.
I think you have Widex and other brands as well. So if you're not hearing your best, maybe it's time to see if new technology can assist you.
Yeah, and I just want to close with the technology is an aid and it's not a cure-all, right? And so we just have to remember that we have to work with the impaired systems that are there, right? I can't give you hair cells back, although they are working on some things for that. But all we can do is maximize what you have, and that is what you want your audiologist hearing aid dispenser to do, is to have you to be able to do your best. So thank you for having us today and allowing us to share information so that we can make better decisions on how to serve you the best.
Okay, so do we have another round of questions? If you don't know how to use the raise hand, I'm gonna try to take a look at everybody and see, put your physical hand up if you've got a question. Nope, anybody? Okay. I did want to say one thing. When we had in-person meetings, I always talked about having, when you go for testing, to have that quick SIN test, that speech and noise test. But when you get the hearing aids, it's really important to have a real ear test. So Anne, would you please explain what the real ear test is and why it's beneficial?
Sure, I went through that, but as a quick reminder, when you do the real ear test, you're actually putting a little microphone in your ear. The person who's fitting you with the hearing aids is putting a little microphone in your ear. Actually, I'm going to reach over Laura here. There's a little device, and you take this out, and this little guy goes in your ear, and then we put sentences in your hearing aid. So we play sentences from a speaker. Your hearing aid picks up the sound, processes it, and then this little microphone sends it to my machine, and we can measure in real time how your hearing aids are performing. So when you're set with your hearing aids, those are to a standard, right? And nobody has a standard ear. When we do real ear measurement, it is your individual measurement, and that allows us to fine tune the hearing aids much more specifically for you.
Okay. Question?
Randy?
Yeah. Okay. Are there any kind of treatment? For example, I have problems with spatial issues all my life, so I have a little bit of a double whammy in terms of not only my hearings are really impacted, but my eyes and the way I was born kind of impact me too, with my eyes. Now, are there any treatments in regard to facial issues, being more aware? I try to be aware of where I'm looking. Because it's kind of a double whammy in a way. What would you recommend? What kind of treatment with that? Are you aware of?
Okay. Thank you, Randy. Laura, do you want to take that one?
Sure. So by starting with making sure that your hearing aids are set appropriately and that your vision is corrected from optometry, the next step for you might be something more in physical therapy. So I don't know if there's something that they could do some sort of assessment and then give you a better idea of whether that's suggestions or exercises that could help improve that. So
Okay.
I don't have a great answer offhand, but I think that might be something worth investigating if you haven't already.
Yeah, I think it's a matter, I'm sorry, hon. It's a matter of me being self-aware, but sometimes it doesn't always work. You know, I have to really kind of pace myself sometimes.
Now, what will that tell Randy when if he takes such a test? That could be very useful. These similar to what, say, a neurologist would give you if you go in for, you think you're having some cognitive decline or something. It's very different. This is related to the hearing aids and how they can help you.
Right.
Like Randy sometimes has a pass or fail attitude, and I try to tell him this is not a pass or fail type thing. It's just more awareness of how much load. This is a fascinating Zoom presentation, by the way.
Well, I would say, yeah, Gail, what I would say to that is,
about that.
Oh, sorry. I'm sorry. Gail,
Go ahead. Taking such a test, what is this going to basically tell someone besides what kind of a hearing aid you would be better at, useful?
So I think not trying to get into specifics and kind of HIPAA guidelines, we could talk about that offline for his personal case. But in general, when you have a significant hearing loss, we know that there are going to be processing issues and delays, and it's more the counseling on the back end to assist the patient and the family members on how to best cope with it. I think that's probably more the way that we would utilize the information of the test. We know the processing isn't going to be as fast as, quote, the norm for his age because of the factors that he mentioned, but it would be counseling on how to best work with it and accept it and use it to the best of your ability by using assistive devices or some therapy or something else.
Okay, Alan, you've had your hand raised. You want to unmute yourself?
Sure. My mom recently got fitted for a new hearing aid, and I noticed that the audiologist didn't do a viewer measurement test. And so I asked her about it, and she said that it was done through the software, but not actual physical one. And what is your view on that? And she did go back and she did do a physical one for me, and it was very close, but between the two. But do you have a viewpoint on that?
So there are ways now in fitting software to do a quick version or a general version of a real ear test. But unless they actually hook up that tube in the ear canal and then run it, it doesn't have the same measurement. So it does not take into account your individual ear canal acoustics. So it was nice that you were able to ask them and then they would do that for your mother. And in her case, it wasn't a big difference, but even a little difference on that test can make a big difference in clarity for someone. Mm-hmm. So we do feel strongly that the physical test, using it on the ear, is very important.
And just so people know, it's not a new test. I have been doing the test for 30 years. I could not ethically fit a hearing aid without doing a real ear measurement to exactly know what's happening inside your ear. The complexity of the test has improved over the 30 years. We used to use just a tone, and then we use noise, and now we use running speech, and we use a passage of speech that's actually phonetically balanced, which means we're looking at different sounds. But just in general, you need to be measured to make sure that what's happening in your ear is really what we're measuring. Unfortunately, when you talk to hearing aid reps, probably 60 to 70% of all hearing aids fit nationwide do not use real ear measurement. Why? I don't know. They say, oh, it takes too long. It really doesn't make a difference. I go by what the patient says. Well, you as the patient, how do you know what it's supposed to sound like? How do you know? You don't. My job as the audiologist is to slowly get you to your maximum point of comprehension. And unfortunately, that's not the way that a lot of hearing aids are fit nationwide. So Alan, I really applaud you for asking for that. Again, as an educated person who knew about the test, you were able to ask, but you shouldn't have to. They should be doing that on a regular basis. That's our professional opinion.
Yeah, I've heard that the real ear test is part of audiology best practices. Mm-hmm. So as well as the quick SIN. And
right, it's part of the best practices. Yeah, it's part of best practices, but it doesn't mean that everybody does best practices.
Too many shortcuts.
Mm-hmm.
That's too bad.
Well,
okay, I know we had a couple of other questions, but the people have already left. So Marilyn has already had a question.
Yeah.
Okay. Well, I think this has been great. You've covered some of my favorite topics, and I hope I get a chance to take the this Cognitive Thrive test again, and so I can do better for you.
Well, what I was going to say is anybody who's on the call, if you would like to take the test, we're offering it free. You can come in and just practice with it. And like I said, we have it right now as just kind of a evaluation portion to see exactly how it plays into the practice. But if you want to, just call the office. We'll put up the phone number at the end, and you'll be able to come in for a test. And it literally will probably take about 15 minutes because you got to sit down and put in your information about just your name and your email. But just so you get a time frame, it's about 15 minutes. Okay?
Yeah, just if anybody's interested, the phone number is 949-667-9818. There it is. Thank you.
Yeah,
well, thank you so much.
Have to come to Florida, would you?
Yeah. Well, I know that a lot of people in Northern California are assessing the equipment. And so it might be coming to Florida. If it does, if I hear of it, I'll let Tony know, and you can go take the test.
Yeah, because the University of South Florida could use them. Yeah, because that's where I have my care. And I think, the audiology department would, thrive on using something like that. So
awesome.
Ship them that way, okay?
Okay. Thank you.
Thank you so much, everybody. Thank you, Anne, Laura, and everybody for attending. This meeting was recorded. It'll probably take me a couple of days to get it up on YouTube. If you subscribe to our YouTube channel, then you'll get notice when I've uploaded it. So thank you all for coming, and I hope to see you on June the 8th. And where Juliet Sturkins and Rich Archibald will be presenting and maximizing the use of your hearing aids. Okay, bye-bye.
Bye, thank you. Nice to see you again, Helen.